So this is a cassette that we developed together with HuFriedy with instruments to make the All-on-4 technique, but in fact they are used also for all kinds of implant surgery. We can do single implants, we can do full cases, we can do All-on-4s. And out of this kit, if we want to do Zygoma, All-on-4 Zygoma, which we call All-on-4 hybrids, then we use these two instruments more. The reason is that for Zygoma, we need an instrument to push away the soft tissue of the Zygoma. So this is an instrument that is sharp and is reversed curved here, so we can pull out the soft tissue and have a clear view, and is long, obviously, because we need to be long. And this is a periosteal that will just push away the periosteum. So it is made, it's quite heavy, so it gives you security. The handle allows you to hold it firmly, and it's a long shaft to reach the Zygoma, and most important is sharp, because the most important thing when you open is to bring the periosteum out. Do not tear the periosteum. So this instrument is very, very useful. Actually, I also use this instrument for the All-on-4, especially for the palate area. It's a very strong, the instrument, it's nicely held. So in the All-on-4 kit, and as I said, all kind of implant kit, the first instrument is this one. This instrument is very, very useful. This instrument allows you to have a nice view of the place you operate. And this is a cheek retractor, pushes away the cheeks, and we can have different sizes. So we can push more, and then by pushing this ring along the shaft, we close it until we close it to a small mouth. So this is one instrument, different sizes of mouth that we want. Then we have the Bishop. This is a very, very used cheek retractor, very useful, not sharp, not to hurt, so we can push the cheek. You can also pull down the tongue. This is a very, very useful instrument, and it's really essential, especially for single teeth, or to help together with this one on the full cases. Then we have the periosteals, which are normal instruments that we've been using for maybe decades. The difference is that we like them to be sharp because we want to be able to push the periosteum out. This is a wider side, and this is a smaller side for single teeth, and for bridges we use this one. Then we have the periodontal probe, which is in one side is actually periodontal probe, and the other side is curved. The curve is specifically used for the All-on-4 and transinus. So we can fit this on the window that we open on the sinus, and then we can probe the inside of the anterior wall. So this is an instrument that's obviously very, very, very useful. And then we have the curettes. We do not need a lot of curettes. We have 2 curettes and 4 sizes. And with these 2 curettes, you can do basically everything. As I said, we want to reduce the number of instruments as much as possible. This is, of course, an instrument that without it we cannot do surgery. This is the scalpel, and I like it because it's heavy and it's nice to hold. If the instrument is too thin, it hurts your hand. Your hand should not close too much and should not be open too much. So we should have this type of size is good. Now on this cassette, you notice that the tweezer is a little bit long. The reason for that is that we can reach deep in the mouth, in the oral cavity, without putting your hands inside the mouth. So with this, you can reach anywhere you want. So we do not need two of these. Some people like it small, but to do the wisdom teeth or the zygomas, you need it longer. So we just want longer for everything. This is a needle holder. We have different types of needle holder. I particularly like this one. It's easy to handle. It's and it's long as well, so we can suture right there at the back or in the front. So try to use one instrument for different occasions. This is probably the instrument that only HuFreedy has. This is a wronger. This is the instrument that really makes the difference between HuFreedy and their competitors. This instrument is very, very accurate, very, very sharp. The quality of this instrument is extremely high, and this is an instrument that is very difficult to manufacture. This is one of the instruments that really describes the quality of HuFreedy. And of course, the scissor. I like straight scissors. I do not like curved scissors. The reason is very easy. The straight scissor lasts longer. The curved scissor normally lasts less, and it's very sharp, and it is long again, because if it's long, we can cut the suture at the back of the mouth, or you can cut in the front. Basically, these are all the instruments I use to do all kinds of surgery in the mouth. I do not need anything else than what is here. With this, I can do sinus lifts, I can do extractions, I can do implants, I can do zygomas, I can do all-on-4s, all here. These two instruments are extra for the zygoma technique, and this is for the all-on-4, but again, it serves all purposes in normal dentistry oral surgery.